We did an interview with Intermountain, and they were talking about how they were addressing social determinants across the state of Utah. They were taking some of the hardest zip codes to provide care. And they were trying to not only move the needle on care, but move the needle on a bunch of other things. And it really requires health systems to do a lot of partnerships. They partnered with the United Way, with local churches. They partnered with anyone who was willing to partner on the health of the community. They were willing to do that. But that requires some dedicated staff, some dedicated technology, some obviously dedicated analytics, but also somebody who really understands building out coalition of the willing, building out those teams and organizing them. It's almost like a community organizer, because you're not going to have any authority over them. You're going to have 10 different organizations. They're going to essentially coalesce around 3 or 4 objectives, and then everybody's going to bring to bear what they can bring to bear to make that happen. But the health systems are well positioned to be the leader in that, aren't they? They're the largest employers in most of these communities. They have access to a lot of the metrics and those kind of things. They really are in a good position to lead here.
It's our obligation to lead. As you mentioned, we are the largest employer in our county, and by a fair margin, but it's important for us to be as much outward thinking as we are inward. We have to be out into the community, engaging those needs as much as the community needs to be engaging with us and coming in for services. So it's very much so about data collection, data analytics, looking at those social determinants of health, but none of it works unless you apply those analytics to different strategic objectives and different projects and implementations that are going to move that needle. So it takes great collaboration with our free clinics, our FQHCs, our local health departments, our not-for-profit networks, and those types of things in order to build those relationships to engage with all of those communities. And every healthcare system has different types of challenges. I had a good conversation with the major healthcare system, the largest healthcare system in Michigan, who created a department to be out in the community for specifically looking at these social determinants of health in their major metropolitan area. They are moving the needle. They're getting engagement from the community, and they're seeing those metrics improve in pockets of excellence. It's not mature yet, but I think every healthcare system has that obligation to meet those care needs to their community.